And I think we will start with the first presentation. It's from Lisa Nee, titled Exploring Current Gaps in Radiation Oncology Resident Teaching, a Thematic Analysis of Responses from a National Targeted Needs Assessment Survey.
Thank you for the introduction. Good morning, everyone. I'm really excited and grateful to be here at ROECSG to present this work on behalf of our team. Oh, I see. Okay. First, some background. So we know that residents are integral in teaching medical students and co-residents across specialties. As a result, many residents as teachers curricula have been developed, and they've been shown to improve resident interest, confidence, and competency in teaching. However, most of these curricula have been developed for core specialties, for example, surgery, internal medicine, and pediatrics. So our questions were, is there significant interest among radiation oncology residents in a formal teaching curriculum? What specifically is unique to the radiation oncology resident teaching experience? And does this lead to different needs? We developed an anonymous 17-item web-based survey using Qualtrics and distributed it via email to 621 residents currently enrolled in US radiation oncology residency programs. We received a total of 171 complete responses for a 28% response rate. And we had a representative distribution of respondent characteristics across gender, race, PGY level, and US geographic region. These are some highlights of what we found out about the radiation oncology resident teaching experience. Here on the left, we found that the majority of radiation oncology residents have not had formal training in teaching, either prior to or during residency. In the middle, we found that residents teach across many learner populations. Most commonly, they're co-residents and medical students, but also other members of the interdisciplinary team. And on the right, we found that residents teach across so many different teaching settings, ranging from one-on-one teaching to departmental lectures, all the way to grand rounds. Today, I want to focus on the open-ended questions that we ask in order to delve deeper into the resident experience and their desires. So the first question that we asked was, what teaching opportunities would you like to have during residency? For which we received 76 responses. We identified some common themes across all of these responses. First, that residents want to expand their teaching to more audiences. For example, medical students in their preclinical years, residents and fellows in other departments. Residents also want to teach in a variety of settings, such as small group sessions, morning didactics, giving institutional talks. And finally, there's variation in the types of content that residents want to teach. For example, teaching about the scope and practice of radiation oncology, or teaching contouring, plan evaluation, image registration. Next, we asked, what aspects of teaching would you like to improve on as a resident? For which we received 68 responses. We found that residents want to improve their ability to prepare teaching material. For example, learn how to efficiently and effectively create slide decks for lectures. They also want to improve the presentation and delivery of these materials. They want to develop confidence in their teaching or develop their teaching identity. And they want to learn how to engage and adapt to their audiences. For example, assess where the learner is and tailor teaching accordingly. We also found that residents desire more feedback about their teaching. On the left, you can see that currently, the majority of radiation oncology residents receive feedback about their teaching almost never or only once in a while. And in our free text responses, we found that there were multiple responses indicating a desire for more formal and structured feedback. So in summary, we have found that radiation oncology residents currently teach across a wide variety of audiences and settings, many of which are unique to the field of radiation oncology. However, most residents lack formal training in teaching and rarely receive feedback about their teaching. And a significant proportion of residents are interested in more teaching opportunities and developing their teaching skills. So next, we're currently refining our goals and objectives based on what we learned from this survey. And we're adapting current residents as teachers curricula that exist to develop a radiation oncology specific curriculum. And we'll keep our radiation oncology residences preferences in mind. As you can see here on the right, here are some examples of the preferences that we elicited. And then we'll be working on a pilot study to test out the curriculum. So I'm very excited about the next steps. Okay, so I want to acknowledge all the members of the team listed here. I especially want to thank Dr. T.O. Thomas, who is also a resident here at UCSF. He's an excellent collaborator in medical education. And of course, I want to thank my mentor, Dr. Steve Bronstein, who is providing invaluable guidance for this project. In the bottom right, that's my contact information. Please reach out if you have any comments, advice, questions. We're very excited about this project, so I would love to talk about this more later today or offline. And finally, I want to thank ROECSG for the opportunity to speak today. Thank you very much.
Thanks so much, Lisa. Fantastic presentation. Anyone who has questions, please put your hand up or type into the chat. But this is actually, by pure chance, a real pet topic of mine, medical education, and how one gets into it through various means. So I've got a question for you, Lisa, which is, from your opinion, what is the base level requirement that's that a doctor should have to be doing any teaching? Is there a base level requirement, or should there be one?
Yeah, so there are definitely some basic aspects of teaching that I think are essential to all teachers. That's a great question. Also, I really enjoyed your presentation about the virtual simulation of talking to patients.
Thank you.
So,
Thank you.
yeah, so I think that for the basics, I think that doctors need to know how to prepare material that is mindful of who their audiences are. And I think that's especially important in radiation oncology because we teach so many different learner populations. So I think that's number one. And then as I saw in one of the previous asynchronous presentations, I agree that feedback, the ability to give feedback and receive feedback, is also a vital part of being a good teacher. And we're definitely going to incorporate that into our curriculum because as a basic, I think that's so important for teachers.
Great, I think you have a great presentation. I know we have to go into the next presentation, but I just want to say I love that you're doing appropriate targeted needs assessments to define your next curriculum, that you're using data-driven format to pursue curriculum development. And I think everyone in the department will benefit from better teaching and presentation, regardless of where they're at.